Hello, this is your friendly nurse and health coach, and I'm coming back today with you diabetes. Diabetes is signs and symptoms of diabetes. You got your type 1 diabetes, the type 2 diabetes, type 3 diabetes, which is dementia. Type 1 diabetes is when you have little or no insulin produced in the pancreas. And this is the usually fatal diabetes because it's an autoimmune disease. Autoimmune disease is when your good cells fight each other. So you got a war going on between your good cells, blood cells in your body. And that's when it starts the autoimmune diseases. And the majority of autoimmune diseases, they do not have a cure. They can control it for so long, but they do not have any cure for it. So some symptoms for diabetes, you will have blurred vision, gaining weight all of a sudden, or either losing the weight all of a sudden, fatigue, tired, being tired all the time, frequent urination, going to the bathroom a lot, and wonder what's going on. Difficult in thinking. You may have brain fog. And you're like, I can't think clearly. Or your child wet in the bed a lot. That's a major problem in diabetes. With a child, they wet their bed a whole lot. Besides excess thirst and urinating a whole lot. They may have some stomach discomfort at times, GI problems, vomiting, nausea. You can have some tests done though. You got the fasting blood sugar test where you fast after midnight, don't drink or eat, and go get some blood work done. And a normal blood sugar is 70 to 110. So the doctor's looking at where you at, your number at, and if your A1C is another test, blood test where you fast after midnight, and your A1C 2 times in a row is 6.5 above, you're in trouble with diabetes. So you want to try to keep the A1C below 6 if you're diabetic. They also got a new test that they can take also. It's new to a lot of people, but it's really not new in the system. It's called HbA1c, where you don't have to fast after midnight for the blood test to be accurate. So they got all these blood tests that you can do for diabetes. The problem is a lot of people don't realize that they diabetic a lot of times until it's too late. And they have about to lose a limb, gangrene setting in. And they wonder what is going on. And they got a major problem going on. Okay, so we have today in type 1 diabetes, which is a major problem. A lot of this is type 1 diabetes. You got about 1.6 million people that have diabetes today in America. 200,000 of them are youth less than 20 years old. And it's a lot due to type 1 and type 2 diabetes. You got 1.4 million adults 20 years old and over have diabetes. Then you got 64,000 people a year diagnosed with diabetes. So this is a high percentage that you see. And like 5 million people will have diagnosed of diabetes, they said, by 2050. It could be that already that they have it and they just don't know it. People have it for years and wondering why they having a lot of GI problems, why they having a lot of nerve damage in their foot and their feet and their legs, and they have discomfort, bad circulation in their leg. Why their eyes are just not blurry all the time, and they can't see good, and they go to the doctor, and the doctor should pick up the diabetes when they look in the eyes, but it don't always happen that way. And then some people don't go to the doctor. They go to the stores and get the glasses, the reading glasses and all, and keep wearing them. And more you wear those kind of glasses, it's going to make your eyes worse and worse and worse if you keep them on and just wearing them like they're a doctor prescription. You can make your eyes worse than they are already. You got to get to the root problem of the symptoms. Not just treat the symptoms, but get to the root problem of the symptoms by the blood tests. Get the FBSs, A1C, HbA1c, and there's also an antibody blood test that you can take for diabetes too. So you have to be very careful with the diabetes. And I want to just tell you some about type 1 diabetes, because a lot of people have type 1 and they're not picking it up right away. And type 1 is that autoimmune disease of type 1. And it can lead to death, and most of the time it does. You got don't have some symptoms at all sometimes. And there are 3 stages of type 1 diabetes. You have a drop in your FBSs, your blood fasting blood sugar or glucose. You may have it drop a lot. You may have it go greater than it should be, way over 110. So your pancreatic enzymes in there, which is your beta cells in your pancreas that produce the insulin, they are not working at all. You got a defect in those beta cells in the pancreas in type 1 because of the autoimmune part. Your body is fighting against itself. Then you got stage 2. You got the pancreas reaching out, and your hemoglobin at the same time is low, like 5.7 to 6.4%. You don't have any symptoms. You just know your hemoglobin just keep being low. And that's a little dangerous when you got your hemoglobin low, because you got your iron and your oxygen, which your heart need, your lungs need, and all your body needs, and your blood cells need to produce just right. Remember, diabetes is a metabolic disease where your fats and your lipids and all your nutrients cannot break down in the body like they're supposed to, because of a high sugar level in your blood and your body. So it being that kind of disease can lead to heart problems, lungs problems, all kind of autoimmune problems in your body, brain problems, which they came up with type 3 diabetes, dementia. So then you have stage 3 of that type 1, where you have the antibodies high in your blood system of blood sugar have got to your liver, which is a main part of your body. It's called the factory of your body that builds up and storage glucose and other nutrients in your body that you need, fats that you need in your body. And sometimes they said type 1 could be also genetic. It can be hereditary. So it can lead to viral infections in your body. And according to your age, it can peak from 4 to 7 years old, have type 1. Children 10 to 14 have type 1. A lot of young youth have type 1 diabetes. So you have to be very careful to have the doctor to check out what kind of diabetes you got. Exercise and weight, sometimes it don't contribute to that type 1. You can exercise and weight and still have type 1 diabetes. Okay? No dietary change and can prevent the onset of type 1 a lot of times. So people say, well, I'm working out a lot, I'm doing this a lot, I'm doing this a lot. But type 1 is autoimmune system disease. So it ain't going to work exactly the way type 2 works. With the exercise, it's going to all help to do that. But the doctor going to have to go more blood work with the autoimmune system. And it got to be controlled more in a way of constantly controlling more of your blood sugar level. You got to watch it more careful and more closely than type 2 blood sugar. Most of them put there's a little like a machine they put on the skin, and you can just check it yourself with your phone, and it's constantly controlled by your phone and the little device they put right on your skin to control the type 1. So the doctor got all kind of ways to controlling your diabetes. We'll be coming back on more diabetes, and we thank you. We love you.